Total bill charge was almost $1 million, and using the magic health insurance discount, it went down to about $600,000. And that's what made me realize.
Welcome to the Entrepreneur Motivation Podcast. I'm your host, Chris Bello, and today I've got a relatively new friend of mine on the show, Mike Patton. Mike, how's it going?
I'm doing really well, Chris. Thanks for having me.
Absolutely. It's great to have you on here, and I appreciate all the cool connections that you have made for me. And just, I already like your influence in my life, so I'd love to share your knowledge with my audience as well.
Well, I appreciate that, man. And it's been a wild ride of entrepreneurship for me thus far.
Yeah, absolutely. And I was reading through your bio, and I remember I overheard something about a $600,000 pacemaker story, which would be a really cool way to get into this. But for those listening, you are a benefits advisor with a passion for helping fix the rampant healthcare inflation problem, which I didn't even realize was a problem. It's one of those things where I think I heard someone say everyone's like one medical emergency away from like being in a really bad financial spot. And a lot of times you don't realize it until you're there. So do you mind like starting off with that story just to like put some perspective for the audience?
Yeah, I would love to. So I'm an ex Division I college football coach turned, I guess, recovering benefits consultant is what I would describe myself as. We also have a platform that wholesales the same product to other benefits advisors as well. But so what got me into the space was after getting fired from one of my football coaching jobs. I worked at my mom's provider's office in South Denver. My mom is a primary care physician, and while working there, I did medical billing for some time. So I was pretty familiar with that process and the mess that is medical billing. So people would come in after that and have trouble with their medical bills, obviously, because if you've ever seen a medical bill, they are a kind of unusual thing to read. And somebody came in and had that very issue. And I read through the claim, and it was a pacemaker that was put in. And what happened was it started falling off. They had to go back in and reattach the same pacemaker. And then the gentleman caught sepsis and was inpatient for a couple of weeks.
Whoa. And
the total bill charge was almost $1 million. And using the magic health insurance discount, it went down to about $600,000. And that's what made me realize that healthcare in our country was completely screwed up. I had some family friends in Europe, in Sweden and Switzerland, respectively. And what I found from them was that pacemaker would have cost like $15,000 and $18,000. This is way back in 2012 at the time in those two countries.
Wow.
And I was appalled, and that is what led me into the benefit space and learned how expensive healthcare could really be in this country.
Yeah. I mean, I hear all the time of people who just go and, they do like a certain surgery in another country, or do like LASIK or eye surgery, for example, corrective vision in other countries where it is more affordable and the surgeries are relatively, high quality, all of that, safe, clean facilities. There are a lot of problems here, but like, what do you see as the most problematic thing? Just how it gets out of control, and there's no really easy way to figure out what the cost is going to be beforehand. Is that kind of an issue you see a lot?
Yeah, I mean, I think the basic of the problem is that it's a third-party payer system, right? So no different. Probably the only other thing you can compare it to, the only other two things you could probably compare it to in the U.S. are paying for body repairs on your car are obviously outrageously expensive because they're always paid for by insurance. You're not paying for the product directly. Thus, the market is inflated because they're billing someone else.
Yep.
Or college education cost. Once again, college education is being paid for by student loans that you're indirectly paying. I mean, you're still paying for them, but you're indirectly paying for them because you're getting approved for something. Chris, you're a business guy, and I'm sure a lot of people are on this podcast. Someone walks in and wants to go get a loan for $100,000 or $200,000 to start a business, especially in a service base. It's one thing to get a real estate loan when the banks understand the assessment value. If they take the house back, they know what they can resell it for.
Yep.
For people like myself who own a service-based business, good luck getting a line of credit without some form of collateral. So the fact that they'll loan you that money on school is all because, it's backed by the government and guaranteed by them. It doesn't really make like true
Hmm.
Put it this way: if you're a bank, you're not gonna without a subsidy from the government, you're not gonna go extend a 18-year-old a $200,000 line of credit and on a degree in underwater basket weaving and expect ROI back on that loan. You would expect defaults.
Yeah, that's a really good way of putting it. Like you said, when you take your car in after you get in a little wreck or fender bender, those people can inflate the prices because they know someone else is footing the bill. There was someone I knew who did storm chasing with roofs and hail damage because
Mm-hmm.
they can just sell it as, hey, you're not paying for this, your insurance company is. And they made crazy money. Just anytime there was a storm, they'd go out there and do door to door sales and sell homeowners on getting their roofs replaced or repaired or whatever the case might be. So that is insane because the incentives are there for people to just take advantage of the system and jack up the prices if someone else is footing the bill, right?
Exactly, and I'm sure some of the people who work in real estate who are familiar with you have seen some of the same dynamics evolve on things like roofing or damage from storms, and the property insurance
Mm-hmm.
has risen drastically. But healthcare is unfortunately much more mature in how long the inflation has been going on. Because back in the 70s and 80s, the hospitals realized that they were losing money on the fixed payer systems, the Medicaids and the Medicares of the world, and so they started to recover their losses on that by increasing the difference back to the commercial health plans, and then they basically just paid it.
Okay.
And so once you're a hospital and you realize, hey, if we just charge more to the commercial payers, they'll just pay it. But we should just keep charging more. And that's
Right.
that's what they've done. And the amount of administrators in the US has risen exponentially. We're probably bloated on administration, but now drugs have become a form of profiteering, and unfortunately for everyone, the profit margins of the health insurance companies is actually capitated. So they have an incentive post the Affordable Care Act to drive healthcare prices up. And put it this way, I bought a significant amount of United Healthcare stock in I think it was 2016, and it was $160 a share. And at least last Friday when I checked, it was trading at north of $510 a
Wow.
share. So pretty good recovery on them. And healthcare inflation in the last decade is well over 200%. So most of that is being contributed. Like, think of insurance in the healthcare space as being kind of the economic structure by which everybody is paying for healthcare for the most part.
Yeah. So I know you said you got into this space after you saw that story, the pacemaker, and how things got out of hand and how you can help solve the problems. I know there's just rampant issues all over the place. How are you moving about addressing this? Because it seems like this is a huge problem. Do we just all fly outside the US anytime we need a major surgery, or like life flight me to Brazil or something? Like, what's the answer here?
I mean, there's been plenty of creative benefits consultants who've attempted that, including myself. I never tried to fly people to Brazil, but there's a surgery center in Oklahoma called Surgery Center of Oklahoma,
Okay.
and they're famous because the doctor there is the president of this kind of think tank called the Free Market Medical Association, and he famously like posts all of his surgical prices on his website. So if you
Wow.
go on there, it's like clicking on going to your restaurant menu. And
That's
if you want
cool.
a knee replacement, you can check out his website. It's like $15,800. Put it this way, here in Denver, hip replacements or knee replacements are going to run you 60 to 90 grand minimum, inpatient in a hospital. So he's willing
Hmm.
to, he can do the same thing, for a fifth or an eighth of the price. And I had tried to get members of the health plans that we constructed to go to Oklahoma City, but what we found out was that nobody was willing to go.
Really? Okay.
Really, yeah. Even if we made it free and covered the cost of travel, for the most part, people were not interested.
They just want to get it done near where they live.
Exactly. They're much more comfortable getting things done where they live. So
Hmm.
what we found is that there's also companies that create similar price structures to Dr. Smith across the country. And, lots of orthopedic surgeons here in Denver. There's a probably the best one. There's a clinic in Northern Colorado called Nodora that's in Loveland, and they post all of their prices online as
Interesting.
well. But there's a number of companies that are willing, uh, outpatient surgical practices, et cetera, around the Denver metro area who are willing to engage in these bundle pricing where their hip replacements are probably $21,000 to $25,000. And so we built a health plan chassis over the course of time. Probably took me the better part of 2016 to 2020 to figure out exactly how to put all these pieces together through really a lot of trial and error.
Mhm.
And what we found is by realigning the incentives, which means that the member has the same incentive as the plan, where to go to both a high quality and a low cost provider. That's actually a benefit back to the plan, because actually in healthcare, there's no correlation between quality and price. Frequently, it's actually inverse, but it's important to have high quality providers, because redoing any of these procedures is actually double to triple the cost of the regular procedure. So you never want to redo anything. So it's very important that we go to high quality, but you can actually get really high quality providers willing to do these procedures at a low price. So we incentivize the member to go to that hip replacement at this specific location, and we reward them by they don't have to pay anything out of pocket for said procedure. So you could need a hip replacement, and members of the health plans that we at Excel Health Plans build would cost them nothing. Like they would
Wow.
literally pay nothing. No office visit, no copay, no nothing. Just the health plan picks up the tab on everything. And we call that a disappearing deductible. So they have no deductible.
That's awesome. I was in a Clubhouse room the other day with some friends, just that audio, conversation app. It's pretty much like a Zoom call for those listening who don't know Clubhouse. I know it kind of like came and went, and a lot of people never got on board, and now it's not as big, but we were having a conversation, a lot of entrepreneurs, self-employed people, about healthcare and not knowing what to do and having a crappy short-term insurance plan. And one guy said that he had to go to the ER for some reason. I don't know if his stomach was hurting or something was wrong. And he realized the hospital he went to didn't take his insurance. He's like, I'm not excited to get that bill. I don't know how that's going to work. So I know we talked about it briefly that one time we went out for that like guys' night and dinner and stuff. What do you typically recommend for self-employed people, for entrepreneurs who don't have a great insurance plan from their companies? Because there are a lot of those people who are in my audience who are wanting to quit. They kind of have the golden handcuffs of, I got a good provider, I have great insurance, but I can't leave, Do
Yep.
you have any recommendations for where someone should start if they just have no idea where to begin?
I do. There's a couple of options that they have. So at some point here in the next 6 to 8 months, we'll actually have an option for self-employed people where we'll make these plans that we build available. So for self-employed, we have to create a very specific legal arrangement. And
Mhm.
to be honest, we're growing too fast, so we haven't had time to put a focus on that. But for all those people who don't, I would recommend a couple websites, and I'll share them with you so that you can send.
Cool.
Probably the
Thanks.
first is one called US Health Advisors, which is non-qualified ACA insurance, but it is owned by United Healthcare, and it does cover you to infinity. So like if something catastrophic happens, it'll cover you, and it's probably costs less than half of what you'll find on the marketplace if you're healthy. And so that's really the thing, is you should save the difference in dollars that you're paying underneath your health plan. And should something catastrophic occur, like you'll have a plan that has a $5,000 deductible with a $7,000 out of pocket limit, which is pretty similar to what you'll get on the marketplace, but the premium costs half as much. And so when I say it's non-qualified, all that means is they don't pay for preventative care. But put it this way, if you need to go get a physical, you can go get a physical done, should be under $200 cash pay.
Yeah.
So the difference that, say, someone 35 years old is going to save between a marketplace plan, especially if you're making a decent amount of money, and that is probably going to be the cost of, the physical, but you
Mhm.
would save that every month. Or I would tell people that if you're going to quit your job, the marketplace from the Affordable Care Act actually subsidizes most of those individual plans. So as soon as you're not making money, you're actually eligible to get a subsidy where you're able to get your health plan for less. And that's either, if you live in Colorado, it's Connect for Health Colorado, or it's healthcare.gov, depending, for a lot of states. Some states like, California, Minnesota, et cetera, have sites similar to Connect for Health Colorado, but a lot of the states use healthcare.gov. And you can also use a helpful website called ehealth.com. That's pretty
Okay.
useful for purchasing individual, or, sometimes in a lot of states you can buy, as you were just talking about, Chris, short-term policies are very useful. So you can get on a short-term policy that'll last you 6 months, be very inexpensive, 60 to $150 a month,
Mhm.
because the plan knows it's not going to cover you for very long. So the reason they can price them so cheap is like if you were to get cancer or whatever, like people, you always hear about things costing people a couple $1,000,000. Well, it usually takes a couple years for them to charge you a couple $1,000,000. So the plan knows they're only covering you for 6 months. They can
Right.
only pay so much out in claims if you're only on there for a maximum of 6 months.
Very
So
helpful.
those are some options. And just remember, you can always get onto an individual plan and you can't be refused right after you leave your job. And getting on healthcare.gov is usually going to be cheaper than Cobra. So will like US Health Advisors. If you're religious, there's some ministry sharing programs called like MediShare that are pretty solid, or Liberty Health Share. Um, and and then also know, if you get on a short-term plan or something like that, if something crazy happens, you can always get on to an exchange plan on 1/1 of every year around that open enrollment time period, no matter what. Like you could be super sick, and the health insurance companies do have to take you on as a member. So
Cool. Very helpful. And then I know a lot of entrepreneurs, they're trying to cut costs, they're trying to like reduce their expenses and bootstrap. Do you have any horror stories or anything you want to share on someone who didn't have coverage? And just like, I always tell people that's not like a cost. This is an investment. And really, it's just like a CYA insurance policy, right? Like cover your ass type thing.
oh yeah, I mean, I haven't bumped into too many people where they didn't have any insurance at all, but I've actually had a person die on a plan that I took over just from being underinsured, as you might describe it. So one of the biggest problems with health plans right now is people are becoming functionally uninsured. So you have a deductible and an out-of-pocket limit that are so high that the member can't afford to go seek health care regardless. So right now you can have an out-of-pocket limit as an individual of $8,550,
Mhm.
and as an individual you can have a deductible of, it's just over 7 grand. And most Americans don't have $1,000
Lay it
in the
around.
case,
Yeah.
exactly, in the case of that event. So you've got a pretty big price gap there between what coverage you might have and what actual capital you might
Hmm.
have. So I had a member of a plan a few years ago who was on a health savings account plan. And how the way HSA plans work is you have absolutely no coverage up front. So like you go see an oncologist, you go see your primary care. There's no copay to get it. You just have to pick up the check on the first portion of the tab. And if you're not getting money on a health savings account to pay for it, if you guys are making money, they can be nice tax advantages. But if you have nothing and you're not putting anything in, you have no coverage up front. So the person unfortunately had an issue with bleeding out of their rectum, and that situation occurred for north of 4 months before the member sought any treatment at all. Because it was a single parent gentleman, in his 50s, couldn't afford any health care. This was a manufacturing company in North Denver, and yeah, apparently his colon cancer advanced from probably stage 1 or 2 all the way to stage 4 during that course of time. And unfortunately, the member died after about 4 months of treatment. And the owner hired us as consultants because he was really kind of horrified. He felt responsible, and like he killed, or was partially responsible for the death of one of his employees
Yeah.
due to his lack of, affordable coverage that, like I said, left that member functionally uninsured.
That's an interesting concept, functionally uninsured. So they had something in place, but for all intents and purposes, they didn't have that money laying around to just make the
Exactly.
deductible. Hmm.
Yeah, and it's a common problem for a lot of people in the US right now because as healthcare costs escalate, there's really not much that companies can do to lower their healthcare costs other than send the cost sharing back to the member in form of higher premiums. So if last year the company, say the premium is $500, this year it's $575, and the last year the employee was paying 100, now they have to pay 175 because the company says, oh, well, I can't afford any more than the other 400. So that can happen. Or what the company might do is say, okay, well, we had a plan with $1,000 deductible and a $4,000 max out of pocket. So in order to keep our rates flat, we're going to buy a plan with a $3,000 deductible and a $7,000 out of pocket to keep that price at $500 a month. Maybe the price is the same, but the coverage just went down. So that's that, or maybe they'll switch from a large network like a PPO to an HMO where you see a lot less providers, or like a Kaiser Permanente to save some money. And that cost shift has been happening every year incrementally for the better part of the last 30 years, but it's gotten significantly worse the last 10 to 12. And when that's happening, obviously it's just being pushed back on the members, and it's getting worse and worse. And as we know, unemployment is really low right now. So a lot of the companies that we're seeing are taking the savings and putting them back. Almost all of them are putting all of the savings back into either enriching the benefits for the employees or lowering the cost for their employees, because they're terrified of their employees leaving, and they want to make sure that they take the savings and reinvest them back into their own employees.
Right. Interesting. So I know that's always, and I mentioned it earlier, that's like the handcuffs that a lot of people have is, I'm just going to stay here because it's too good to leave. Like, I've got my benefits, I got 2 weeks of paid vacation. And I think I remember hearing something about like Mark Cuban and some entrepreneurs wanted to put something together to incentivize people to become entrepreneurs, because it's such a risk to throw all of that stuff away, that a lot of people who would be contributing helpful ideas and businesses and, revenue producing, job creating things, they're not entering the marketplace just because they are so comfortable at those jobs and that kind of stuff. So do you mind sharing exactly how you're working with these companies and businesses? And like, you come in, you design health plans for them, people who don't have plans or who just have terrible plans? Is that kind of along the lines? Could you elaborate
Some
a
of
little
both.
bit more?
We work with companies who don't have any plans at all.
Okay.
But most of the time we're working with companies with 50 to 150 right now, and we're expanding up market significantly fast with the number of employees. And we'll come in and for instance, the company will have a current premium of, let's just say the average age of the group is 40 years old. It's a plumbing company in Texas. And they have, like I said, maybe they've got 50 employees on the plan. What you'll probably see is that the average price through Blue Cross or United Healthcare, say they're going to pay $600 a month, and that buys them a plan with a $3,000 deductible and a $6,000 out of pocket. In health insurance, there's basically just 2 deductibles instead of 1, like your auto insurance. So you have one where it's actually your deductible, and then a second one where there's like a spread and the plan pays 80% until you hit the cap. And that's pretty much how health plans work. So frequently how it'll work is we'll be able to set up a plan that will save the company, say 15 to 30% on the benefits. And then the benefits actually become richer, because should people need a lot of those expensive conditions, expensive specialty medications or injectables, things like chemotherapy, or if they need surgery of all kinds, outpatient or imaging or lab work, they can actually go get all of that for free on XL Health plans. So we're both lowering cost and making the benefit for a lot of things that would cost members richer at the same time. And the interesting thing is it's the behavioral change of getting the member to go to the lower cost, higher quality location. Imaging is probably the most frequent, most expensive up price. A lot of times you'll find an MRI at a hospital costs $4,500. And pretty much always we can find an MRI at almost every metro area in the US for under 500, usually probably around 400. So we incentivize the member to go get that by making it free, and thus the overall spend of a plan stays down. So
that's really helpful for sure, because I think like most people who find a real estate agent or something, I'm just thinking of myself, they don't really know how that process works. It's their first time really ever buying a house in many cases, and they rely on you, the expert, or they just kind of Google or go with the first person they find if they have some good reviews. So I would imagine most people just say hospitals near me, emergency centers near me, and they just go and have no idea that they're paying $4,000 more than the place half a mile down the street.
Or they're referred by their provider. And a lot of times there's no scientific method there either.
It's just a short list.
Actually, it's worse than that. So when I worked in my mom's office, we referred to whoever brought us lunch. So
That's how it
I wish I
honestly.
was joking, but no,
That's how real estate works too. Like you bring lunch over here, they send you some business. Like it's a relationship business, you know?
I mean, and it's the same way in healthcare, but at the same token, like there's actually macro ways with big data now where you can measure, hey, this person does X number of ACL reconstructions. They have, Y number of redos, and they have, X number of
Wow.
infections per surgery. So you want to send it to the people with a really low infection rate, the really low redo rate. But you also want providers in most of those scenarios who do a lot of volume, because the more volume you do, the better you are at something. You don't really want to go see a provider where they do 2 of them a year. Oh, they did them flawlessly, but they did 2 of them. You'd rather have someone who screws up occasionally, but does 150 of them. Because
Exactly.
thus, when something does inevitably go wrong, they know how to
do it.
respond. They have that experience.
Yeah, 100%. I think I heard someone talking about something similar in terms of you would pay more money for the person who knows what they're doing, even if they could do it in a fraction of the time. It might have been like Alex Hormozzi's podcast. Like you want to go to the best surgeon who's done it 5,000 times this year alone. And yeah, it costs a lot more and they only take 20 minutes to do it versus going to the person who has like a lower hourly rate overall. It takes longer to do, but they don't have the experience that this more experienced person does, right?
Yeah, and the dirty secret that's ridiculous in surgery is that like almost all of what you're paying for is not the surgeon. So like if you pay like my dad had his hip replacement was $130,000 at a hospital in South Denver.
Yikes.
And the surgeon only made I think $4,000. All the rest is being paid to the anesthesiologist, the device, but almost all of it just goes to the facility charge.
Wow.
So you can pay a lot of money for a surgeon. You can spend 5,000 instead of 4,000, 6,000 instead of 4,000. And a lot of times we're able to get the lower cost because the surgeons themselves actually own a piece of the outpatient surgery center. So if they do it there, then they basically get the cut that the hospital would be getting. And so they're willing to, they're just recovering a higher net of the margin. They're like you guys in real estate. They're both the commercial tenant and the building owner. So more money for margin there.
Interest.
Exactly. So you know what? It's great though in this model because they're just trying to pay anesthesiologists $3,000 for your hip replacement, pay $2,500 for the device, which the hospital, by the way, is also going to buy for $2,500, and then upbill our health plan and charge us $14,000 for the same device they paid $2,500 for. And then they're just going to recover as much as possible off of the rest. If they charge 21 grand, then it's more for them to keep, and they make more than they do in the hospital, which is good for us.
Jeez, there's so many things that we can uncover here, and I feel like I don't know, maybe it's one of those things where I just never want to look into it. I just have some insurance person tell me, hey, which plan do I pick? I don't know what happens if I get hit by a bus type thing. But it looks like these resources you shared, US Health Advisors, healthcare.gov, ehealth.com, those are great places to start, as well as your website as well, obviously.
Yeah.
So I know you
check us out.
Yeah. What's your website? Drop it.
It's xlhealthplans.com.
xlhealthplans.com. So Mike, this has been amazing. I know you got other meetings you got to run to. Heard your phone ringing over there.
Yeah.
Where can our audience learn more? Is that the best place, or should they follow you on
personal
and then
Instagram, also follow me on Twitter. My handle is, I'm going to be changing it here, but right now it's Coach Mike Patton. And then also you can check out a great resource. It's called Health Rosetta. I'm a member of a consortium that's all about bringing about change in healthcare. Healthrosetta.org. And the plans we build are actually, co-authored by them. They help us, quality control them. So check out healthrosetta.org. A gentleman named Dave Chase, he's the ex-Microsoft benefits CEO. So
wow. It's really cool what you're doing. I didn't even realize this is one of those problems I didn't even realize was such a massive problem. So it sounds like there's a lot of opportunity. You guys are growing very quickly, which is amazing. And I appreciate you taking the time to explain this. And sometimes it sounds like a foreign language, like deductibles, copay, like out of pocket, all these different terms.
Yep. Warren Buffett calls healthcare the tapeworm of the American economy.
Wow. Warren Buffett. He's always dropping some knowledge. So yeah, if there's
Yes.
any way I can ever help, man, let me know. And of course, anyone who has questions, make sure to go visit your website, Mike's website, visit these other resources, and maybe reach out. If you got an email or something on there or support, if they could reach out, that'd be awesome as well.
Thanks.
Thanks, Mike.
Appreciate it, Chris.